Hello, everyone. Welcome back to our first Tech Talk for 2025. As always, we're here to talk about digital transformation for the aged care sector. My name is Janine Bennett. I'm the Assistant Secretary and Engagement Lead for the Department's Digital Transformation Program, as well as your moderator for today's webinar. I'm joining you today from Canberra, the lands of the Ngunnawal and Ngambri people, and I'd like to recognise those traditional owners as well as the people and families with continuing connection to the land and waters of this region. I pay my respect to this country and to elders past, present and emerging, and to any Aboriginal and Torres Strait Islander people joining us today. Some quick housekeeping before we start. As always, if you run into any connection issues during your time with us today, we have dial-in details that are on the slide here and also in your meeting invite. So go ahead and use those if you run into any technical troubles. Today's session will also be recorded and the video will be shared on our departmental website in the coming weeks. So if you or your colleagues would like to watch it again, you can refer back to it there. The purpose of these webinars is both informative and to have a two-way conversation, which is why we do our best to leave plenty of time at the end for questions and discussion. If you have a question, please share it by opening up the Q&A tab at the top navigation bar on your Teams window. You can type in your question and so when we're ready to start the Q&A, they'll be there ready and waiting for us to go to. If you'd like to ask your question live on camera, we'd love you to join us on the Tech Talk stage. To do that, please just make sure that your name is used when you type your question rather than using anonymous. And then when the time comes, I'll ask you to raise your hand in Teams so we can find you in the virtual room and bring you up to stage. From there, we'll make sure your video and audio is on, and then you can go ahead and have your conversation with the panel. If you prefer not to appear on camera, I'll ask your question on your behalf. Those ones just post anonymously or write no stage in your question, and we'll go ahead and present those questions for you. Keeping in mind that our focus here at Tech Talk is on our technology and delivery work, we'll answer all the questions that we can on the spot, and where we need to, we'll take questions offline. I'd also like to quickly welcome any media representatives who are attending today. We appreciate your ongoing interest in our important work and in the aged care sector more broadly. A quick reminder that media questions should go to the department's media and events team at news@health.gov.au. They're best placed to assist you with these formal requests, but we appreciate you coming along and staying in touch with the digital transformation work. And now on to our agenda. So first up is Faye Flavaris with an update on the digital delivery roadmap and some other short but important updates. Next, we have a guest presenter who is being welcomed from Uniting. Andrew Dome will talk to us about how his provider organisation is integrating AI into their care services. Following that, we welcome our colleague Catherine Beich from Services Australia, who will be talking about support at home integrations between our agencies. And lastly, we'll get an update on the status of the single assessment system from Marguerite Gandini, who is one of our leads in the Digital Transformation and Delivery Division. And then we'll wrap up with our live Q&A. So with all that, it's my pleasure to introduce your host for today, Faye Flavaris. Faye leads the department's digital transformation work and has recently been appointed as the department's Chief Digital Information Officer. Faye is a skilled technologist and an IT architect who brings her extensive experience in leading transformational change in private industry to her work here at the department. Faye, welcome. Great to see you again, and over to you.
Just get myself off mute. Welcome. Thank you, Janine. Hello, everyone, and welcome to back to all our regulars. And for all of you joining us for the first time today, we welcome you. I think I say this every year, and I'm going to say it again. 2025 is going to be another big year, a bumper year of exciting changes in the aged care reform space. And in that spirit, we have a lot to cover today, so I'll just get on with it. Let's start with the digital transformation roadmap for aged care. This is the forecast of our current work plan. Now, as per usual, I share this with the usual disclaimer. This is our technical delivery roadmap. What you see here is the digital delivery plan that my team and I are working on in the department. It is important to note this timeline supports the aged care reform agenda, but it should not be considered an official commitment from government. That happens elsewhere, outside of our tech talks, usually through ministerial announcements and other formal mechanisms. But you will notice that our roadmap has changed since our last update. But as I say at every tech talk, we make a point of sharing this roadmap early and often so that we can be as transparent and open with you as possible on the work we're doing and what we're planning for, which allows us then to co-design these activities with you. But sometimes things change and the policy decisions evolve, or the priorities shift, or work gets delayed. And when that happens, we call it out here. So we let you know where things have moved and changed. Now, if we look to the details, the main addition you can see in the release in March to April, that's new information. This has been added to prepare internal procedures and systems to be ready to operate under the new Act. So when we last spoke to you, that kind of wasn't there. Our delivery window for February is well underway, with the highlights being that we're making changes to the My Aged Care portal to allow care recipients' exceptional circumstances to be captured. This includes information like Aboriginal and Torres Strait Islander statuses, homelessness or at risk of homelessness, family connection reasons, and urgent residential respite, and so on, in other examples. In preparation for the new Act, we're making further changes to My Aged Care to support the rollout of the new supported decision-making framework. Enhancements are also being made to the single assessment system with the introduction of the new triage delegate role, and making enhancements to the assessment delegate form to reflect new processes. The My Assessor app will also be decommissioned to support the new single assessment system. So you can see lots of things on the move, folks. We're enabling the submission of the supporting documentation to support the younger persons in residential aged care delegate to decide eligibility for younger persons' access for government-funded aged care. And we're enabling First Nation clients to specify their preferences to be assessed by First Nations assessment organisations. We're also implementing a new case management system to support new Aged Care Act and manage complaints, compliance and serious incident cases in an integrated manner with the Aged Care Quality and Safety Commission. Additionally, we have the 3 new staffing quality indicators will be added to the new Aged Care Mandatory Quality Indicator program, with the focus on enrolled nursing, allied health and lifestyle officers. And then the business to government gateway APIs will be updated to incorporate these new quality indicators as well. For star ratings, the staff rating will be updated to reflect the combined care minutes for registered nurses and enrolled nurses. So providers and consumers will be able to view the new combined care minutes in various portals. We're also adding an explanatory note section alongside the staffing rating and the overall star rating. So lots of new enhancements, as you can see, and we will continue to update you on the changes for the coming March and July releases in future tech talks. Now on to some of the new sector resources that have been published. Across the department, there has been numerous resources being produced to help the sector adapt to all the new Aged Care Act changes. This is not just for providers, but for individuals and their supporters, for software developers and more. When it comes to digital, we linked a few resources on this slide for you to consider. There's rules for the quality indicator program. There's support at home claims and payments if you need more information on those 2 reform measures specifically. Additionally, the Support at Home Provider Transition Guide outlines key readiness steps ahead of the 1st of July in a nice table for you to check off within your organisations. This is just, we've just cherry picked a few of these for the selection for Tech Talk audience today. For all the available resources, more is available on the department's website. And if it doesn't exist now, it will be released in the coming weeks. We also don't want to overwhelm you with too much information. So if you're looking for a quick way to cut through all the noise, we highly recommend signing up to the Your Aged Care Update newsletter. It comes out each week with handy summaries of what's happening in the aged care reform space. It's available on the department's website, and we've added a QR code for that one here as well. Okay, so here's one example of the resources that have been made available recently. It's the GPMS Guide to Digital Changes for Providers. It was produced by our colleagues in the Digital Reform Branch and was published in December 2024. The guide introduces the digital systems enabling provider operations under the new Aged Care Act. So this guide is specifically targeted to aged care providers. We understand that providers will guide the design and delivery of digital systems for the new Act. So it was important to structure the guide to show how government systems can best support their journey. The guide explains how digital changes support providers and is updated as new information is released. So, regularly check back on this one. The goal is for the guide to eventually include links to key information such as field updates, categories, rules, and support software systems development. So where specific data is unavailable, it is noted along with the proposed method and timeline for providing it. So the next update is expected to come out this month. We use provider feedback from the sector departmental forums like this one to supply further granularity of information and address areas of feedback or particular interests that need more transparency or explanation. You can access the guide using the QR code on your screen, and then there will be further details will be found in the program handbooks and system guides available on the department's website. So moving on to the next piece, I want to make a brief mention of a new digital transformation impact assessment project that we're launching. We've launched this new initiative in response to feedback that we've received from the sector and the implementation task force. We'll be looking for providers, assessment organisation, ICT software vendors and suitable experts to join a multidisciplinary team with us in government and with all the sector representatives. And together we'll work together to identify critical path impacts to providers preparing to adopt changes under the new Aged Care Act and Support at Home program. So we'll soon be opening an expression of interest on the department's Aged Care Engagement Hub today or tomorrow, just trying to get through the last steps of the process. And we're inviting participants from the aged care sector with the intent of developing resource guides and solutions and extra information around what the impacts are on you guys in the provider and sector landscape and what you guys need to do for the 1st of July. So less about us in the department and more about what's it mean for you in your operations. So this is where the multidisciplinary team will come out to these providers with their software vendors and go, what does that mean? Off the back of this, we will then create some archetypes around have you considered, you're a large organization, have you considered these impacts? You're a medium organization, have you considered this? So the goal is to provide you with the tools you need to better understand how the changes will impact your organization, helping you to become prepared in your and adapt ready for 1st of July. So please keep an eye out for that expression of interest. We've also got the Digital Maturity Assessment Survey for aged care providers. It's launching this week. So your organisation might have already received an invite to participate. If not, registrations are now open for Aged Care Engagement Hub. Head to the Get Involved page and look for the Aged Care Digital Maturity Self-Assessment or the QR code here. The self-assessment tackles 4 important questions. What is the current level of digital maturity for aged care providers? What are the key barriers and challenges inhibiting aged care providers from improving their digital maturity? and what are the types of support and enablers that providers need to help to improve that digital maturity? And finally, what are the core elements of the digital maturity for aged care providers that you think will lead to success? So it's using an industry methodology. It covers 10 domains. It's a self-assessment, and then the digital maturity across such as strategy, frontline workers, and innovation. And we will present those results in future tech talks, and looking forward to all organisations that complete that can also opt in to receive a personalised report and how they compare to the benchmark. Okay, lastly, a reminder about a current grant opportunity that is available. Applications are still open for the one-off grant of $10,000 to support home care package and Commonwealth Home Support providers to help their business side of updating their IT systems. Applications close next Tuesday, the 25th of February, and you can find out more information on the health website. Use the QR code here. It's a quick link to get there. And the link will be up on the QA panel in a few moments as well. Sorry, that's not it. We'll have it later on in the Q&A as well. That's for the digital transformation update. There was a lot there. There's a lot of information. So let's get moving on to our next agenda. And I'm very excited about this one. We have a bit of a change of pace to our usual updates. I have the pleasure to introduce this one. Like other care sectors, there's plenty of thinking and innovation happening in aged care. And while we're still relatively early in some of our maturity life cycle, exploring AI to enhance how aged care services can be used is a hot topic. And so I'd love to introduce you to Chief Digital Information Officer Andrew Dome, who's with us today to talk about their AI journey. And I'll welcome you, Andrew, and over to you.
Thank you, Faye. And I would just like to start by saying congratulations to you, Faye, for your final appointment as the Chief Digital Information Officer. Great title, by the way, for the DOHAC. And I know it was announced last month, so well done to you. Very well deserved. So, yeah, really excited about having the opportunity to present today around what we're doing at Uniting New South Wales ACT. And just a sort of quick run through of the agenda, what I will be walking through is quickly just talking through who we are, Uniting New South Wales ACT, and what we do. I'll then give you a bit of an insight into our generative AI journey and the use case that we decided to run with and the reasonings why we chose that one. I'll then talk about the proof of concept we created, how we got the business involved at the very outset, and also the executive buy-in and the board buy-in. I'll talk about the implementing our security controls and governance that absolutely needs to be part of that process to make sure it's a successful implementation. And then I'll finish off with a little bit of a insight, I guess, into how we got our executives and our board on board for this journey and some of the, I guess, the techniques that you can use in your own organizations to make that happen. So if we can just go on to the next slide, if we can. So Uniting New South Wales ACT, who are we? Well, we are a service provider that is providing community services and senior services throughout New South Wales and ACT. So in our aged care space, we provide home and community services as well as aged care services. Mental health, mediation and counselling services and early learning services are provided via our communities directorates. Overall, we have a mission, and that is to disrupt entrenched disadvantage. And that really is about what it says on the tin there, is looking at disadvantaged communities and people and providing a much better life for them. So that's our overall mission. And as you can see from this extract here from our 10-year strategy, and we do have a 2032 strategy, you can see people are actually at the heart of everything we do. And when we talk about our people, we talk about our employees, and we also talk about the customers that we serve every day. So if we can go on to the next slide, it will give you an idea of the size of the organization and what we do. So we're fairly large. We currently service about 146,000 clients per year. 118,000 of those are in communities, 27,000 are in senior services. We're 13,000 employees, 11,500 of those are full-time, and then we have a large number of volunteers as well, which, we are very, very thankful for. We are a non-for-profit. We're one of the largest in Australia. We have 1.3 billion in terms of revenue that we bring in every year. And of course, we spend 1.3 billion in outgoings because we are a non-for-profit. We have a 10-year strategy that began in 2022. I came on board in 2032. And at that time, we were servicing about 110,000 clients per year. And as you can see by that figure above, we're at 146,000 clients now. So we're well on track to be servicing 200,000 clients by 2032. We can go on to the next slide, please. So what are we building? What are we doing? And what are we actually creating in this generative AI space? Well, look, we're really, really excited about this. We've got some great foundational pieces here at Uniting in terms of the core platforms that we're running on. And because we've got that and we've had some really good investment in that space, it's enabled us to really look at innovation and look at AI and how that can add some value into our organization. And what we've created is something called Digital Assistant. And that Digital Assistant is a persona-based AI co-pilot assistant that is going to add real value to our employees. And what do we mean by that? What we're trying to do is we are trying to take the administration burden for our employees, particularly at the coalface, at the point of care, and taking those sort of 15 to 20-minute activities that they might have to do many times a day and make them into 1 to 2 minutes activities, thereby returning that time back to our customers. And we have a mantra or a comment here that we like to use, which is we want to hold the hand and not the pen. And that's quite self-explanatory. We want to remove those administration activities and tasks, and we want to hold the hand of our customers. So taking those 15, 20-minute activities and make them 1 to 2 minutes. And by doing that, that's returning 13 to 18 minutes back for our employees to actually look after our customers every day. Now, I'll give you some examples of what that actually looks like. And as you can see on this slide, there's a couple of screenshots down on the left-hand side, and that's the persona Sarah. Sarah works in our aged care environment. We have 7,500 aged care workers in that sector. And that first screenshot there is Sarah asking a question. And that question is, what is my leave entitlement? And you can see it's a very simple screen. It has a kind of Google-less ChatGPT field. And Sarah can just type into that field by text a question, what is my leave entitlement? But better yet, what she can also do is use voice to text to speak into her phone, her smartphone. She can do it in a native language. We have a high percentage of Nepalese people that are working in our aged care sector, so they can speak in Nepalese. It will convert that into English. And at the point of care, when she needs it on her smartphone, she'll get that content retrieved pretty much instantly. It's like a ChatGPT experience where it comes through. How does that work? Well, that front end will connect into our back end systems. In this particular case, it's HRIS system, and it will retrieve that content. And you can see there, she's asked the question, what's my leave balance? And it's returned her annual leave entitlement, or sorry, annual leave balance, her long service leave, sick leave, etc. The second screenshot there, we've now got Sarah with a separate use case. She's seen an incident in the aged care environment or the site that she works at, and she wants to report it. So again, she can use her voice to text. She can then ask or add content into our Quasar system, which is our incident system. Now, traditionally, how she would do this is she would go away, she would sit down at a kiosk machine, and we might have 3 or 4 on each of our sites used across 120 people. She would log on to that machine. She may not have to use Quasar very, very often. She may forget her log on details. You know what happens? She rings the service desk. She has to spend some time there. Again, it turns into a 15, 20-minute activity. And then she finally completes this. By using that smartphone as the new device of choice for Sarah, it's again making this into a 1 to 2 minute activity, returning time back in the day, again, to look after our customer. The third screenshot there, that's where Susie is now looking after a customer in Westmead, one of our sites there, called Sarah. She's been away for a few weeks, and she just wants to know what is the care plan for Susie. So she's asked that question. It's returned that care plan back for our particular customer, and she can move on. So again, she doesn't have to go to a kiosk machine, spend 15, 20 minutes of doing that. And in future, she'll have the ability to actually create the case note for Susie, again at the point of care, without having to go to a kiosk machine later on in the day where some of that content is actually lost. So very, very powerful tool. So that's what our digital assistant is really all about. It's reducing administration burden. It's uplifting that experience for our employees, ultimately allowing them to spend more time with our customers. And if you can imagine this times by 7,500 aged care workers every day, the amount of time that we're going to get back for our employees is going to be significant. So if we move on to the next slide. What did we do? How did we work out this, and what was our use case that we decided to start with? Well, the first thing you've got to point out is this is not IT by any means saying we've got some Gen AI and we've got some great use cases and we're going to push it on the business. What we've actually done is we consult with our organisation. So we went out to all of our directorates, senior services, aged care providers, communities, and even our back office functions and said, well, what are your pain points? What are the pain points that you need us to resolve? And out of that consultation, we came up with quite a number. We then evaluated those pain points. And what we decided to do was go with the least risk one that was easy for us to scale and easy for us to bring to production. And the first use case that we used was policies and procedures. And we have quite a large number within Uniting. And the reason that we decided on that is the use case was easy. The data that was in those policies and procedures, we knew because we created them. We knew that they were up to date. We knew there was no PII, and we knew that the risk was very, very low with the security controls that we put in place. So that's what we did. We evaluated that, and then we chose that particular use case to run with. So if we go on to the next slide, you will see we went into our build phase. So this is now creating our proof of concept. So we developed our proof of concept around that policies and procedures, use case number one. We have a very, very good network of friendly users, change champions, SMEs, whatever you want to call them. And we ran this past them. But what we were very conscious of, again, was making sure that we had a cross-section of our users across all of our directorates, our aged care, our communities, property, finance. And the really, really important thing about this is we provided a feedback loop to them so that they could, as they started using this digital assistant for policies and procedures and asking the questions, is getting the feedback through so that the LLM, that digital assistant tool, could learn. And the really interesting thing in this whole procedure or process was the questions that IT thought they would ask were very different from the ones that they were actually asking, because they're at the coalface. And they were asking questions like, well, what is the policy around having animals coming into an aged care environment? And that was different from what IT was saying, which was things like, well, what is my leave entitlement? So very, very important to provide that feedback loop for your people that are testing this in a proof of concept. And then the last part of that process was around adapting. So we tweaked that large language model, that digital assistant, to make sure that we'd listen to what our employees were using it for and scaling it out and adapting it for the end result. So if we can go on to the next slide. Here's a really quick timeline of what we actually ended up doing. So we obviously did our discovery in advance. We ran those workshops with all of the areas within the business and got their buy-in around those use cases. But what I really want to call out now is you can see the executive buy-in. Do that right at the start of this exercise in this process. So when we had those use cases or those pain points that we were trying to solve using generative AI, we had the conversation with our executives and also our board, and we showed them. We showed them what this digital assistant could do. We showed them the benefit of that, and we got the executive buy-in right in advance. We then went to the next stage, which was creating that proof of concept. We built the environment, we kicked off the activities, got in our testers from the business. We then completed that proof of concept, put it into production, providing feedback to our executives and the board all the way through there. And then I guess the final part of that was we've now expanded it out. The way we actually created that digital assistant originally was hiving off our 441 policies and procedures in our Azure instance, pointing the digital assistant to that to make sure that we lowered the risk as we were implementing our security controls and data classification in parallel. We've now gone back to the more traditional model where we now can put that digital system right across our SharePoint online sites, and it can get the right data, the right content without us having to hive off our policies and procedures. So we go on to the next slide. This was a kind of a one-pager that we created. Again, very useful when you're having conversations with your executives and board. You can see on the left-hand side, those were our 441 policies and procedures by area, by directorate. And on the right-hand side, what we got there was the verbatim comments that we got back from our employees, those people that were testing the Gen AI tool. And you can see at a high level, it's all positive. You know, it's very good, easy to operate. Confidence going to add some value there. Great for our frontline support workers. It's going to enable a self-service approach. It's available 24/7 when perhaps the service desk isn't around to answer questions. It's fast. And it really is like a ChatGPT type experience where the content's being retrieved to our employees at the point of care within seconds, negating the need for them to go and sit down at a kiosk machine and spend 20, 15 minutes doing it. So if we can go on to the next slide. Now, great call out here. Key call out is you can have the greatest generative AI tool out there that you've created, you've developed, you may have partnered up, but really you've got to make sure that you do this safe, securely, and ethically. So make sure that whilst you're doing this and looking at proof of concept, you're implementing the right security controls and governance in parallel. So when you start off small, and we went with that use case, which was around understanding our data, knowing that we had policies and procedures which were publicly available on the intranet, but difficult for our employees to find. We knew the data, we knew that there was no PII, so the risk was low, and that's why we could get the buy-in from the executives. We brought in the experts. We brought in some Gen AI partners in conjunction with Microsoft, and that was all around ensuring that they could bring that knowledge around AI to the party. We certainly don't have AI experts in the organizations. It is obviously a fairly new technology and platform. I know it's been around decades, but where we are now in terms of the technology, you need to partner up with people that have got experience in this space. You have to create it and develop your Gen AI policy in parallel. So when you're speaking with your board members, you know, they're all about risk mitigation. They'll want to know that we've got some robust Gen AI policies and guidelines for our employees. And a really interesting thing that we did is we brought in the ethics center. We had a professor come in, we had a session with our board and our ULT, and we really ran through some use cases to them to say, what level of Gen AI and how much will we allow Gen AI to do things within our organization? We gave a number of use cases. I'll tell you about one of them, and that was, would we allow generative AI to create a care plan for our customer? And whilst Gen AI could do that right now, ethically, the consensus was, no, it's not the right time. There could still be bias. LLM, the model is still learning. That could be something that we could do in the future with a human in the loop, obviously, to QA the actual content. But that was really, really important, an ethical conversation around the safe use of AI. So make sure you start to have those conversations with your board to help develop that policy around the use of Gen AI. And if we can go on to the next slide, which I think is the last. So really, how did we go through this cycle, and what did we do to get all of our executives on board? So the first thing was, you need the buy-in from the outset. You need to know, or you need to get them to understand the value, show them the value, get them on board very early on the piece, as you saw on that timeline I showed before. The easiest way to do that is to present that low risk use case to them where risk is mitigated, you know, PII might not be involved, and you've got your security controls in place. Talk to them, have that conversation around that responsible ethical AI use. Show them that you've got your AI guidelines that are being created in parallel. Show them and present it when those AI guidelines have been completed, and get their buy-in and the approval to do it. Leverage the board member advice. You need to remember your board sitting on other boards, probably across your sector, but also across other sectors as well. And they are having the same conversation around AI, around use cases, and around the ethical and responsible use of AI in those other organizations as well. Ask them what they're hearing, ask them what their other organizations are doing, and get them to input into those conversations, because that's what they're there for. They're there to steer, mitigate risk. So have that conversation with your board. And then finally, obviously make sure that your security controls are in place. If you've got a program like we do, which is constantly running and implementing security controls, make sure that they are in place ahead of a wider productionizing of your generative AI tool. So in summary, if I can kind of just cover off that quickly, what I would say is start with an easy use case, understand your data and how to control it, get your executives on board, and very early on the piece, explain the benefit and the value of what it's going to give to your employees and ultimately your customers. Build and prove your POC, show that back to your executives and board, create your AI policies and guidelines in parallel, implement your security controls. You do all that, and I guarantee you'll have a successful AI journey. You'll have your first use case done, and then you can just build on that for the future. That's what we're doing at Uniting. It's exciting times for us, and yeah, can't wait to show you the other use cases that we bring on board in the future. And that's me. That's my update for Uniting.
And that was an amazing summary. Thank you so much, Andrew. Like, it shows how innovation in action. You're thinking big about it, but you started small. And while you were, doing the small bit, you thought about what are all the other foundational pieces you need to get in place so you can continue your journey. You brought all your stakeholders along with you. And I really want to thank you for sharing with us and the community. It's always good to see how other people have walked the path, and we learn from you. So thank you very much. And I'm sure we'll have you back on a follow-up later on.
Thanks, Faye.
No problem.
My pleasure.
Okay, so without further ado, we move on to Support at Home. Very thrilled to welcome our second guest speaker for today, as a big part of our audience has been asking how the different government agencies' systems will interact with each other. Each of the agencies has a different scope of work, but of course we work closely together to make sure as much as possible we have a one government and ICT journey for all of our users. So as many of you will know, Services Australia has a large remit supporting the services associated with Support at Home. And before I hand over to Services Australia colleague, I'd like to mention that many of you may have attended their webinar on the 10th of February around the Support at Home requirements. So this may be a useful recap for some of you, but hopefully you'll pick up some new things as we discuss it with others. So with that in mind, now I'd like to welcome Catherine from Services Australia to take us through it. Over to you, Catherine.
Thanks, Faye, and hello everyone. It's really great to be with you today, and most importantly to be able to provide an update from Services Australia. My name is Catherine Veach, and I'm the Director with responsibility for the Support at Home project. With me today, I've got my colleague Darren Chambers. We also have some members of our ICT team in attendance, and they may be able to help out with some relevant questions later on. As Faye's mentioned, Services Australia does indeed have a significant remit for the Support at Home program, and has responsibility for implementing broad-scale changes ahead of 1 July implementation. I'm aware that today we have a very diverse audience, and for that reason I thought I'd touch first on the role that Services Australia plays within the aged care space. So, on to our next slide. I think we've got that one up, thank you. In the aged care delivery context, our service delivery teams have responsibility for calculating consumer contributions and assisting consumers who may be experiencing financial hardship. We also play a key role responding to inquiries from providers and their staff, and we have responsibility for managing user access to relevant Services Australia systems. Another role we play is to host and maintain software to integrate Services Australia systems with provider systems. We work with software developers to ensure that software specifications and APIs are in place to support the changes. And this has been a really key focus for our ICT and business teams this year. I also wanted to acknowledge and call out the role of our aged care specialist officers. We refer to them as our ACSOs. Our ACSOs play an important role educating and supporting older Australians and their representatives to navigate the aged care journey. Our ACSOs and Financial Information Service Officers, or FIS, provide specialist services by appointment, either face-to-face, over the phone, or virtually. Services Australia also provide telephony support for consumers, nominees, and aged care providers. So, what's changing under Support at Home? Well, our teams are very busily working on the technology solutions that will enable the aged care means assessment and payments to be made in line with the new legislation which will take effect from 1 July. We're making the necessary changes to process subsidy and supplement payments to approved aged care providers. And most importantly, to support consumers, nominees and aged care providers with the changes, our specialist ACSOs and FIS and our service delivery staff will be trained to support the changes from 1 July. Next slide. Many of you in the audience today may work in the software developer space. And if so, it's possible, as Faye mentioned, you might have attended the Services Australia quarterly software developer information session webinar that was held yesterday, or you may have attended our aged care specific webinar on the 10th of February. Both of those webinars provided content that we will touch on today. Recently, Services Australia released drafts technical specifications for Support at Home program. We talked through these changes at the webinar last week. I guess I wanted to convey today that we know how vital it is to share the information we have as early as possible, which is why documentation is being released in draft to allow developers as much time to prepare as possible. We also take developer feedback provided to us via our webinars and use that feedback to make updates and refinements. Information will continue to be made available as information comes to hand and as policy settings are finalised. Once versions are final, Services Australia will communicate that information with software developers and share the updates via the Health Systems Developer Portal, which is Services Australia's developer portal. I should add here that the Health Systems Developer Portal is different to the Department of Health and Aged Care Business to Government or B2G developer portal. So our Health Systems Developer Portal is the go-to place for all technical specifications and information to support integration with Services Australia systems. We might move to the last slide. So before I wrap up today, I just wanted to point out the best way to get information on our changes. For software developers, Services Australia will continue to communicate with developers to help prepare for the implementation of Support at Home and other aged care reforms. We have a range of forums and communication channels available to provide information and gather feedback. And these include our monthly aged care webinars, email updates from our developer liaison team, updates to our FAQs on our Health Systems Developer Portal. We have a quarterly newsletter and our quarterly information session webinars. All developer information can be found on the Health Systems Developer Portal, which is shown on the screen, and you can just follow the pathway shown there to find the information you need. It's also where software developers can find webinar recordings and Q&A from previous webinars. As updates to our specifications and Q&As are made, we will make developers aware via an email from our developer liaison team. They'll simply advise there is new or updated information available so that you don't have to check back constantly to see what's new. For any providers in our audience today, information to support providers will be updated on the Aged Care Provider Portal Education Gateway. This is the place to find any aged care provider professional education resources. The information available on the gateway will be updated over the coming months as policy settings and changes are finalised. So thank you everyone. I really appreciate your time today. It's been great to be able to provide you an update on Services Australia's role in support at home. Back to you, Faye.
Thank you, Catherine. Really appreciate you guys coming and joining us here. And we thank you for working closely with us in the aged care reform work. Okay, so what do we have next? We have welcome to Marguerite Gandini. She's one of our acting assistant secretaries for the Aged Care Funding Reform and Systems branch. Today, Marguerite will take you through the single assessment system overall, I think, Marguerite. I will hand over to you.
Thanks, Faye, and thanks for the invite. This is my first tech talk, so I'm a bit excited for the opportunity to talk about both the single assessment system as well as providing a bit of an update on the Aged Care Assessment app. I know that that's of keen interest to quite a few people attending today. So my colleague Catherine from Services Australia is actually giving you some really great information, I think, on the changes ahead at Support at Home. But I'm sure many of you will already have experienced, we've actually been on the transformation journey for Support at Home, I would say, for well over 2 years. So today I want to focus in on bringing together the key changes implemented under the single assessment system, what have been delivered through a staged rollout, because they've actually set us up for the introduction of Support at Home in the new Aged Care Act on July. So you'll remember last year in July, the first layer of capability we introduced, it was an improved assessment process. So we replaced the National Screening and Assessment Forms, known to most people as the NSAF, with the new Integrated Assessment Tool, so the IAT. So they're available in both the Assessor Portal and the new app. The new IAT contains over 950 different configurations and questions, and it includes features like pre-filled data, triaging processes and streamlined workflows. So those improvements have helped us actually capture and retain data better. And I think importantly, it's reduced the need for clients to repeat their information multiple times. The system's structured questions have guided the assessment process in a way that's more tailored to take into account the complexity of care needs and circumstances of clients. As part of the Support at Home changes being introduced on 1 July, we'll actually also be enhancing the logic that sits behind the IAT and making it more efficient for assessors and lining up with that assessment outcome from an in-home aged care perspective, so home care packages, to align with the new Support at Home model. The IAT was also supported by the introduction of the new Aged Care Assessment app. That app replaced the ANAC and My Assessor app, and its core function is to help with the workflows of the assessment. So it's got the capability for offline assessment, has automated data uploads into the health systems as well. I'm going to just say here that the Aged Care Assessor app is more than the IAT. So I think we've all been a little bit guilty over the time of using IAT and Aged Care Assessor app interchangeably. But with the integration of the ANAC app, what it actually means is that it provides this mechanism to also support the assessment of residential aged care funding. So that's in direct support of the establishment of the single assessment workforce. So for providers with workforces in both the in-home aged care space and the residential aged care space, they're actually now able to use one consolidated app instead of two products. The app itself is built on the .NET Maui platform app UI, which is quite a mouthful, and that's better known as Maui. We've been an early adopter of Maui and it introduced it in October 2023. And that was a really deliberate choice as it's provided us with a lot of upfront and early benefits. As I've just talked about, it's paved the way for us to create a single app to support the single assessment workforce, and it's allowed us to build apps for multiple platforms, so Windows, iOS, Android are our main users, from a single code base. So from us, it's saving us significant development time and allowing us to be a little bit more responsive to changes. And of course, it's saving us maintenance cost. I think most importantly, for users, it ensures a consistent experience across both that assessor portal and the mobile app. Now, it would be fair to say that there were some teething issues after the initial release. Developing new technology does take time, and while we try our very, very best to produce a high quality product, as with any new technology, there's always going to be a few initial bumps in the road. And I just wanted to take a minute to acknowledge and thank everyone who provided feedback. In the early days, it was invaluable in helping us identify some of those key causes for the app crashing. So as I mentioned, the IAT has over 950 questions, and it also has a complex logic flow underpinning it. So it was one of the key contributors inflating the memory usage within the app. Using the feedback provided from this cohort and our other users, we've been actually able to narrow in on some of those very specific workflows and screens that were creating some of the data crash issues. And memory loss issues in the background. We've been actively making our code as efficient as we can using that feedback and addressing some of those gaps while Microsoft matured their product. So we did deploy 2 fixes, so one in the first week and then 4 weeks directly after launch to address some of those early issues that were escalated. And since then, our focus has been on improving the performance and stability of the app. And we've seen really significant improvements in memory usage and decrease in the crash rate since last version was released in October last year. I'm very acutely aware that adoption is going to be driven by those first few experiences of users. And while understandably some users are still a bit gun shy, I'm really pleased to see. I was having a look at the uptake stats the other day, and we've seen real big improvements since we introduced the version in October last year. We've seen a steady uptake of the app across iOS, Android and Windows. So it seems to be that everyday users' confidence is growing in that product. We do appreciate your patience as we make these enhancements to provide a better experience for everyone. If you experience some teething issues and have been a little hesitant to take up the app, I really would encourage you to try again next week. After next week's release. The team have been working really hard through all of the feedback that's been sent in today. If there is one point I want to make, it's please don't stop giving us feedback. We're not done yet, and we really do need that continuous loop to help us improve the product. There are feedback channels highlighted within the app. We've also got the email address just shared on the screen at the moment. All right, I'm conscious I've spent a bit of time talking to you about the new app, as I know it's been a pain point. Hopefully I've been able to address some of the concerns or give you some updates on how we've been working to improve it. Before I do move on to talk some more about the single assessment system, I will just flag that we will be decommissioning the legacy apps as part of next week's release. I know my colleagues in business have been providing supporting comms and information to you all, but to confirm from next week, the legacy mobile apps, so that's your My Assessor and ANAC apps, will be removed from app stores and the sideload distribution channel, and interface links from the legacy mobile apps to SeaWorld backend will also be removed. While we're talking about sideloading, we are also working on streamlining that process and providing an executable version for the July release. That's as a direct result of some of the feedback that we got from the R30 and R31 sideloading processes. So we'll be keen to work with stakeholders to help us understand how we can make that sideloading process easier. And the sector partners team is going to be facilitating some conversations for us. So if you're interested in participating in those discussions, just reach out to them and they'll coordinate that for us. Okay, so let me wrap up quickly just to talk about the remainder of the changes that we've introduced under the single assessment system. So in December, the system changes we rolled out under the single assessment system workforce allows organisation conducting aged care needs assessments to do both your home support assessments for CHSP as well as comprehensive assessments. And then next week, the final changes to the single assessment system will be delivered to focus on enhancements to the triage delegate role and the assessment delegate form. And that's to align with the broader single assessment system structure and functionality. So bringing those two components together for users, the single assessment workforce is going to provide a single assessment pathway for older people, so they don't have to change assessment providers as their needs change. It's also ensuring access to assessments in regional, remote and rural areas and reducing the wait times to access an aged care assessment with a broader workforce availability. To complement this, in December last year, we also broadened the aged care ecosystem to work with our colleagues in Services Australia and the Australian Digital Health Agency to introduce the capability to upload support plans to My Health Record. So using a consent model, clients are now able to have their support plan stored on their health record, allowing healthcare providers to also see the assessor's report on client needs. So that's giving them insight into assessor observations and recommended aged care services. And going back to that point that I talked about earlier, one of our critical priorities is making sure that we're reducing the need for clients to tell their story multiple times. And I think this is a really great tool for that. So from the department's perspective, it's allowed us to successfully establish that foundation capability while managing operational and strategic risks associated with like privacy, data integrity, cybersecurity, and of course, business continuity. So this is the first step in exploring the broader interoperability across aged care and My Health Record. But for us, it's been a really significant milestone. And I've just got a couple of little fun facts for us to hand. Since the project was active, or since we went live in December, in the first week we had 4,500 My Aged Care Assessment support plan successfully shared to the My Health Record, and that was in the first week. As at last week, we had nearly 50,000 matched clients that have consented to their support plan to being shared to My Health Record. That's today. Now, that's about a nearly 85% success rate, in a pass-through rate in terms of consent. So not only is there a great adoption of support plans into My Health Record, but the consent to do so and connectivity, it's a really great outcome. Speaking of milestones, we are approaching our 10-year anniversary next month in Aged Care Gateway, and I'm sure some of you have been along the journey with us, which has been one of continuous innovation and improvement. As we reflect on the significant strides we've made in enhancing our systems and launching new applications, we really did just want to acknowledge the important role that the Tech Talk and sector partners have had in helping us address these challenges head on. So looking ahead, we're all systems go, focusing on the implementation of Support at Home and the new Aged Care Act on July 1st, and we're really looking forward to working with you throughout this transition. I hope this has been useful in helping bring together some of the changes over the last 12 months and bundling the single assessment system changes, but also to address some of the questions about the app and do a little bit of myth busting. So I might hand back to you, Janine, or to you, Faith. Thank you very much.
It's me, and thank you so much for that, Marguerite. Now, I think you might be hanging around with us for Q&A.
I am indeed.
Lovely, and I can see there's lots of Q&As, and so I'll ask Janine and some of our panellists to come online with us. We might see if we can shrink the slides so we can get us people there instead. So I think over to you then, Janine.
Great, thank you, Faye. Hi again, everybody. Welcome to our panel for today. So we have all of our speakers on screen, Faye, Andrew, Catherine and Marguerite. We're going to be joined by one of our business contacts as well, who unfortunately had a conflicting meeting but is running from that to us. So we're hoping to have Emma Cook here as well to give us some of the more policy-focused answers to questions that we have. For my team, when Emma arrives, feel free just to pop her up on screen and we'll go from there. Okay, we also have a bunch of subject matter experts and standbys ready to help as our phone a friend if needed. So we'll get through as many questions as we can in the time we have left, and it looks like we've got a good half hour for questions, so that's great. I would like to start just by giving a bit of a screen warning to a couple of folks who raised questions with their names. And if I could just ask these people if they wouldn't mind raising their hands in the team ribbon. That way we'll be able to find you easily. So Karen from Alchemy Technology, if you could raise your hand. Leanne Bradbury, if you could raise your hand, we'll bring you to screen as well. And Sophia Markwell, some really good questions there that were popular. If you guys could all raise your hand, that would be great. In the meantime, I'll start with an anonymous question. So we had a question regarding the Support at home claim upload file. Will this be accepted in CSV format as it is currently for HCP claim upload file? And I'm thinking that one might be Catherine.
I can speak to that.
Great.
Kat, I'll jump in there. Darren Chambers here from Services Australia. So in answer to that question, the simple answer is yes. I think the question was asked probably based on how that function exists within Services Australia for home care claiming at the moment. So certainly that will be maintained for support at home in terms of uploading. So I'll leave it there. I think that's the short answer for that one.
Great. Thank you, Darren. And sorry for not welcoming you to stage as well. I didn't realise we've got 2 folks from Services Australia. That's awesome. Very lucky. Okay. How are we going with Karen? Can we move Karen to the stage so she can ask her question? Hi, Karen. We'll just get you to turn your video on if possible and come off mute and feel free to ask your question to the panel.
Hi, thank you for that. Just wondering what avenue we would be expecting to hear about the changes for CHSP and the DEX reporting. It seems to be a space that's not being communicated in many avenues.
That one would be a new one for me. Does anyone on the panel have any insight on that one? Otherwise, we might need to take it on notice. No, I think it's a take on notice. I'm sorry. Can you give us a bit more insight on the question though, to make sure that we get, and we can actually ping in the background and see if we can get one in the next sort of 25 minutes.
Yeah, no worries. So going by the department websites for the grant extension for 2025 to 2027, there's proposed changes to the CHSP service list and also to the DEX reporting. Those documents haven't changed since December or November, and so we're still waiting on information there as to what's happening in that space.
Okay, so I do have the standard line that I'll give, which is the design principle that we've tried to take on is that we keep as minimum change as possible. So if you haven't seen a change, that means there's no change yet. But what I'll do is in the background, we'll just ping one of our policy colleagues and see if we can get an answer. If we can't get it in the time period, we'll definitely put it in the Q&A follow-up that comes after the tech talk.
Great.
Do you have any other questions while you're with us?
Just that one, thank you.
Thank you.
Thanks, Karen, and we'll keep monitoring that one. If we can bring Leanne to stage, that would be great, Tim. Welcome, Leanne. If we can have you turn your video on and turn off mute.
Yes, apologies. It's the, don't know if my camera's going to work. There's a few storms. No, it's not.
It doesn't matter. No worries. We can hear you. That's the main thing.
Yeah, so my question was just more regarding clinical. So I find that, and the AI and everything is fabulous, and the My Health record is awesome, but the main challenge I find in home care is that trying to get GP updates for medication, recent medication changes, health changes. If clients go into hospital, they're discharged and the hospital changed their medication or they've had a serious event and it's not communicated, then the nurses in community care are expected to go out and yes, we discuss it with the clients, but they're not always aware. And personally, it took me 6 months to get one GP medication list and health summary. So my question is that if we can get a GP health summary, medication list, and a hospital discharge list all on My Health Summary, I think, yes, it's great to have the carers and the coordinators having reduced load, but the nurses for clinical also need a reduced load for chasing clinical need.
So this speaks a little bit to the interoperability agenda. Faye, I might direct this one to you.
Sorry, yes, I know it's a big thing, and I've asked the question before, so I do apologise, but it's just
don't apologise. It's actually really good that you guys raise these things, because I think it helps to highlight where the big pain points are and the friction points are. Yes, it is a big problem statement to solve for, but there is a couple of things happening. There's the broader interoperability agenda that Janine just referenced, which is we are trying to get information models and standards in the way we all communicate together. To that effect, and it's probably hot off the press, is that I believe this week legislation was passed to mandate sharing by default. So it's no longer going to be optional for GPs and others to not share or rely on, consent of the individual. So that's a recent change. We might see if we can grab the link to the announcement that happened. I think it was on Tuesday.
And I might interject there, and that's great, but we actually send to the GPs a consent form from the client that is signed.
Yes,
but
no, I understand.
Still don't provide that information. So it's not a consent thing, it's just a lack of resources at GPs or
understand.
Not. I don't know, but
so actually
it's challenging.
The new legislation that was just approved means they are legislatively tongue twister, sorry. They are legislatively obliged to now share that by default in My Health Record, and that will now become available to you guys through that mechanism. Now, I can't exactly tell you when. I'll take that
that's okay.
on notice.
Yeah, but so I know that was approved for RAC in the facilities. Is that approved for home care now as well as the aged care facility?
This is approved for all digital health legislation. So it goes beyond aged care. This is a much broader sharing by default legislation for clinical care. I'll find out the details and send it through. It may not address your use case in the short term, but it will in the long term. I think pathology results are a first start. There's a much broader agenda there as well. But I've noted your pain point.
Yeah, I did raise this question prior, and they said that yes, it was being introduced to RAC, but it wouldn't. The home care sites don't actually have access. The nurses are for home care, aged care. Let me get my words out. Home care, aged care do not have access to the My Health records for our clients.
Okay,
and that is the challenge.
So we'll take that insight. Thank you very much,
Thank
Leanne,
you.
and we'll follow it up and hopefully give you a little bit more of a summary after the tech talk.
Yeah, sorry, I know it's a big
Don't
question.
apologise.
Sorry, thank you.
It's a big one, but we take the big questions here. It's fine. Thank you very much, Leanne. Appreciate you coming to stage. We'll move Sophia up onto stage if we could. And Andrew, I think this is a good question for you. And just to note, we've got a couple of questions that sort of follow this similar message, one of which is an anonymous question. And the anonymous question is, how can a not-for-profit standalone organisation afford that without funding? And I think they're talking about some of those great solutions you're introducing with AI. And if at the same time we can move Sophia to stage and she can do a follow-up for her question, which is very similar.
Yeah, look, it is a great question. And what I can tell you, in Australia, certain organisations have a real non-for-profit focus. And Microsoft, as an example, has the Technology for Social Impact philanthropy area, which gives us the ability to partner up with them and deliver solutions. So that digital assistant and that first use case policy procedures we created, that was absolutely done, co-designed, co-created in conjunction with Microsoft. And there is probably the capability for that to be rolled out to small organizations moving forward. It is a conversation that's been had within that circle about how do we leverage that technology, which some of us have put some investment into for smaller So I'm happy to take that offline and work with the TSI team within Microsoft to see what can happen in that space. And I think it was Sophia that asked that question. Yeah, so happy for her to reach out and have that correspondence with her.
Yeah, great. Thank you, Andrew. And we had an anonymous question that was along a similar lines as well. Just that idea that smaller facilities don't have that same economy of scale that you might have, and it obviously takes them a lot longer to get on board. So anything they can do to leverage what's available in the industry, I'm sure they'll really appreciate. We also had a very quick question about the license for the AI app, which I might hit you up with as well. So the app for personal care attendants or AINs, was it app-based licensing or Microsoft F1 licenses? I'm hoping that.
There's a hard question.
That's a good question. So there's a few things happening around licensing, and as a non-for-profit, Microsoft have different layers of pricing, and what I will say is they're very generous in terms of discounts they give for non-for-profits. Our generative AI licensing, our generative AI tool sets was based on their Copilot for Azure, which is different from Microsoft 365 Copilot, which sometimes people get confused between. They actually result in different outcomes. So Microsoft 365 Copilot, that's the stuff you may be used to with summarizing Teams and doing transcripts and giving you some sort of insights, summarizing your Outlook. We are doing that in parallel, but that's not what we're talking about with the digital assistant. It was their Microsoft Azure licensing model that we used, and I can tell you, because they are really wanting to drive this out in the non-for-profit sector in Australia, they essentially went all in on Uniting, which I am really really positive about and thankful for. So there wasn't a lot of investment on Uniting side, if I'm honest. If you are looking at Copilot licensing for the other side, that Microsoft for 365 Copilot functionality, they are offering discounts in Australia for non-for-profits, but it's not at the same level yet as the discounts that you get as a non-for-profit for their other licensing like E3, T1, E5, etc. So hopefully that answers the question. But again, happy to take it offline and kind of work through what that looks like for anyone that's interested.
Yeah, and we might hit up our Microsoft contact as well and see if we can get some clarity on the question and provide an answer from Microsoft through to our community as well.
That sounds great. Thank you both. Okay, I'll give a screen warning to Tracy Buchholz and William Quinert, I think I've pronounced that correctly, and Stephanie Klingen, if I can, please. And in the meantime, we'll do another anonymous question. So this one is, are there plans for the APIs being provided for Support at Home to allow for provider software vendors to access information from the integrated assessment tool to minimise data entry into client management systems? So is this one for you, Marguerite?
Maybe, or she might want to throw to me, either or. She'll get herself off mute.
I can't get myself off mute. I'm in one of the new little rooms, and I don't have all my mouses and bits and pieces here. I'm operating off a laptop, so sorry, I'm a bit slow. So look, I think we know, and I actually recall, Faye, this might have come up at a Sector Partners when we first launched back in July last year, that there's an absolute interest in understanding how we can better leverage the B2G, that software portal for us to use APIs to share the information in the client space. I think that is something we're absolutely committed to exploring, and we need to get our foundations right first and get the Support at Home and NACA delivered. And then that's something that I understand is part of our digital roadmap into the future thinking. There's obviously a lot of considerations that we need to think about from a privacy, security space, etc., for us to do that. So it does need to be a thought through piece, but I'm sort of urging that I know that that's something on our agenda that we want to engage with people about into the future.
That's right. And just to add to Marguerite's comment, So we did do a bit of a survey towards the end of last year and asked the community what they would like to see in the API catalogue roadmap. That space, the referral space, the client space, that, you know, that continuity of data through the value chain at the beginning is definitely a focus area. We are currently analysing all of that roadmap prioritization. So that's why it's definitely in the list. We just can't communicate to you when, like what date, because we're just trying to groom it all out with all of the mandatory changes for the 1st of July. So watch this space, I guess. And we do know it's a priority area and a pain point. And so we're trying to get it there as soon as we can.
Great, thank you. And if we can bring Tracy to the stage, hoping Tracy put her hand up. Hey, here we go. Hi, Tracy, welcome. If we can get you off mute at a minimum, and if you've got a camera, hey, there you are.
Hi, how are you going?
Great to see colleagues from Ageing Australia.
We're very happy to be here. I think my question is for Marguerite. We're just wondering if the department is able to provide a sample of the support plan that participants will receive under Support at Home. Just providers are really unsure about the level of detail that's going to be provided, and therefore what they're going to have to do when they take on a Support at Home client in terms of their level of assessment and things like that. Especially with this principle of trying to reduce the number of times that a participant will have to tell their story.
Yeah. Look, Tracy, I know that that's something that I've been working with our business colleagues on in terms of what we can provide in respect to templating, and we are still working away in the background on all the design solutions for some of those elements. I can sort of give you a heads up that there actually isn't much that has changed in the support plan. There is just 1 or 2 additional fields, but absolutely I'll talk to my colleagues from over in business about making sure that once we get through the design and into that build phase that we provide you with a sample of the template data. But I think that that's something that should be relatively straightforward to provide.
Amazing, thank you.
We'll take it as an action item.
An action, yeah.
And in our post wrap email, we'll try and put a date to it once we've, so you can know when to expect it. Thanks.
Thanks so much, Tracy. Appreciate the question. And if we can bring William to stage now, that would be great. How are we going, team? Oh, I think I have to ask on William's behalf. So we've actually got a few questions from William, and he wasn't able to come to stage. So let me go ahead. The first question is, are there any new requirements for the participant monthly statement? What are the legal obligations for the participant's monthly statement? Will government provide templates? Is this a good question for Emma? I'm thinking it's not here.
It might be, but if I recall, this one here, the monthly statements, there was actually a sector partner design activity for that one. So we might take that one offline and actually again provide a bit of a summary wrap on that one. And so yeah, that's part of the change agenda to come. I might just leave that at that one there.
Yep. Next question from William was, what is a service group within APIs and how does it differ from other service data fields in the approved services list?
Yeah, so I might ask, I'm going to redivert that one too. All the APIs, there's a bit of a help desk that you can go to on that. That's a way detail that I'm across at the moment. And so just drop an email to the API support team who look after the conformance process. They've got virtual drop-in sessions that you can actually register for and get help on the APIs and how you can code for those. So again, we'll just give you a link to the drop-in session and you can go and ask the question of the experts there.
Yeah, great. If the team in the background can have a look for the link for registering for the drop-in sessions and the details around that and put the information in the chat space, that'd be great. Okay, the next question from William is, what are the expected timelines for NOI testing, NOI?
No, I'm going to guess that's with the B2G guys. I think we might divert all of the Will's questions that way. They're all very technical implementation specific questions. Yeah, beyond my current B2G expertise.
All right. So just for our B2G subject matter experts that we have in the audience, if you want to drop answers into the Q&A for these particular questions, please feel free to do so. You can actually comment on specific questions. So if you find the ones that are around APIs, you can just answer Will directly there. Okay. And I think I'm going to have to ask Stephanie's question as well. Quick question for Stephanie, and then we'll grab one for Andrew. It's hello. What will be the timing for the Services Australia to calculate client contributions? Will providers have to charge an interim amount or a percentage from service commitment? Is that a Catherine question?
It is. Unfortunately, I don't have a solid answer for you yet, Stephanie. It's a very important question. I know that people are wanting to understand what's happening around transitional arrangements, but some of that is still very much being worked through. So as soon as those policy discussions are being finalised, we will share that information and obviously work with our colleagues in Department of Health and Aged Care to make sure that information is made available to you and other relevant stakeholders. But it is an important one. We're very conscious about trying to finalise that as quickly as possible.
I think that discussion is still ongoing, I think. So I'm not sure, Catherine, do we have an ETA on when we think we might close it out to give the audience a bit of a view? Do we think it's like 2 weeks away, 4 weeks away, just to give a bit of an ETA?
Faye, I really don't know if that sits on the Services Australia side. It's probably one that's sitting more in Department of Health and Aged Care space, just from a policy perspective.
We'll follow that one up. There's a lot of detailed orientated questions here today. All good.
Yeah. Great. I'll give a stage warning for Mona Lisa, if I could. Mona Lisa, if you don't mind putting your hand up so that the backstage people can find you. And then also if Chen can put her or his hand up as well, we'll go ahead and cue you to come to stage. In the meantime, we had a question about the aged care digital transformation maturity assessment. So someone said, when do we receive invitations? I signed up for this some time ago. Faye, do you want to take that one?
You can take it yourself.
I was going to jump in, but then I thought,
no, go for it. You were
just to blur the lines between moderator and question answerer. So we were planning to release that self-assessment last year, but as it turned out, it actually conflicted with another survey that is released on a regular basis by the department, the Pulse survey. We didn't want to put the burden on the sector to have 2 surveys going at the one time. So we deferred our survey. You should receive an invitation in the next week. So if you haven't, feel free to reach out to us. We can drop an email address, just our external contact email. If you don't receive it, definitely let us know. But for all those people that have nominated to participate, you can expect your invite for that self-assessment in the next week. And as Faye mentioned earlier, there is a really nice little feature to completing that, which is that your organisation will receive a targeted report just for you, which benchmarks your responses against the rest of the sector participants. So we would definitely appreciate people opting into that one. Okay, how are we going with Mona Lisa? Can we bring Mona Lisa to the stage? Hi, Mona Lisa. Beautiful name.
Hi, thank you.
Hi, jump in with your question.
So I think my question was answered before around, it was the same question about APIs, and if it was when, I guess, it will happen to facilitate ease of data transfer to our CRM.
Yeah, so yeah, we'll definitely take that one on notice. Sorry, Mona Lisa. We don't really have the exact timing yet. We are prioritizing all the critical legislative changes that have to happen for the 1st of July. It is actively being worked on, though, in the background, and I do hope to make sure that we have a view of the timing and the catalogue next month. Let's fingers crossed. So
Perfect.
hopefully that gives you a little bit more of an insight.
Thank you. Appreciate it.
Thanks, Mona Lisa. Popular question, so definitely one we'll need to get an answer for. And if we can bring Chen to stage, I think we might finish up on that question. Do we have a hand up for Chen? No, maybe I'll ask the question on their behalf. Is this integrated into a digital clinical management system? I'm wondering if that's the same question.
I know what the question is, yeah. So
thanks, Andrew.
So when we're talking about our digital assistant before, and we said, I mentioned around our care notes and the ability to do voice to text. Well, that's only one half of it, right? It needs to go into your clinical system. If it was in a native language outside of English, it would convert it into English and then put it into a clinical system. So the use case, Gen AI use case is being done now. And now we're looking to integrate it, yes, absolutely, into our clinical systems. And we have different ones. We have ones for home and community care and a different system for RAC as well. And both those systems are looking to have that API and integration, because the real value is for an employee to be able to do that case note at the point of care. It goes directly into either of those two systems, depending on where they work, and the job's done. And again, it's turning into a sort of 2-minute activity, not a 15-minute one. So absolutely, that is the last part of it, is API integration into those clinical systems.
So Andrew, given that we said, yes, it's clinical systems, and I'm just picking up a thread on, in the Q&A from one of our other people, Brandon, he was saying, so I know you haven't implemented Gen AI in work that involves PII. Well, that was your first phase anyway, but that is in your pipeline, which you're just saying now it's integrated to the clinical systems. And
it's
so
not
that is...
yet.
It's not yet. Okay.
Yeah,
so getting there. So he'd like to know, what is your thinking of maintaining the privacy of the client information while still exploiting the use of Gen AI, especially using the LLM to help caseworkers with the case notes? What have you guys thought about that link between PII, clinical, and privacy?
And so that's why you need your security controls in place as part of your security program rolling out. So the reason we went with that use case, which was policies and procedures, there's no PII, there's no PHI, personal health information in there. We knew the content in there, so that was easy for us to bring it to market and production. We know that there's PII, we know there's PHI and clinical care notes and everything else, but we're implementing in parallel our data classification around all of those and those files. And only such time as we've implemented those security tools and comfortable that they are going to secure that data, only the right people with the right access have access to that data, can we then complete that integration via that API into our clinical system. So there's a number of programs of work happening in parallel to actually finalize that second use case.
And I think that was the key. You said only the right people with the right authorization, which means you're classifying your data, you're classifying the documents. Then you've got role-based authentication that connects the right people to the right data at the right time, so that it's not just surfacing up all information to anyone. It's actually only giving the right information to the right person.
Yeah, and that's probably the biggest fear of most executives and board members when you are talking about the Gen AI journey. What are you doing? What controls have you put in place? What are they? And what are they going to restrict, and make sure the right access, data is secure, it's only going to the right people.
There's a question about in-house or offshore development when you created the app, which I think speaks probably to the security piece as well. Quick answer on that one.
So we used Microsoft in conjunction with a partner. That partner was majority onshore. There was, and when we talk about offshore, was New Zealand. So there was a few people over there that were assisting, but it was predominantly onshore development. And the impact on our team was our resource and time to help facilitate and do the Azure work. So combination, but most of it was onshore.
Great.
Excellent.
And one really good question, which I'll just try and sneak in very fast. Are you providing the devices from your organisation, or are employees using their own devices?
That was a great question. I did see it earlier. So we've got an interesting situation in our hack where we provide the hardware, that always has been the case. So that first use case where we want to have our case note for a client in hack is going to be via a Uniting issue device. When we pivot across to RAC, where we actually have people using their own devices, we're just working through the process to do that by updating our BYOD policy, making sure that they enrolled in Intune. So again, we've got the security and controls around there, and it's done in a safe and reliable way, as you can imagine. So it's actually a bit of a mindset change of Uniting, of how we're going to approach RAC. But if we're focusing on hack, which is our first use case for this one, they're absolutely provided by Uniting.
Great. Thank you very much. I'm going to have to call that. We've run right up to the wire. Thank you so much, Andrew. Lots of positive comments about the Gen AI journey that Uniting's taken. Looks fabulous. Love your work, are a couple of the quotes I can pull from the questions. Really popular subject and super interesting. Catherine, thank you for coming along from Services Australia, and Marguerite, always great to have your branch here, and nice to have a first-time Tech Talk presenter as well. And unfortunately, Emma, our policy lead, didn't arrive on time, but we have heaps of questions that we can follow up with our business stakeholders later and come back to the group. So thank you very much all. That is our Tech Talk. Please be aware that our next Tech Talk is scheduled for Wednesday, the 2nd of April. Please mark this one off in your diaries. If there are any agenda items that you would like to see discussed, we're happy for you to email us and let us know in advance, and we'll do our very best to cover that material at the next Tech Talk. As always, a reminder that this is an open forum. We love to see the diversity of views and opinions. If you know others who would be interested in this topic, please share the link to the Tech Talks with them. And with that, Faye, I'll encourage folks to complete the post-event survey available from the QR code and hand back over to you. Thanks very much.
Thank you. And thank you, Janine, for great moderating as per usual. And to all of you in the audience, it's been lovely to be with you here again. We hope you found the session insightful. We apologise. There's always way more questions than we can get to, and sometimes we don't always have the answers at hand. But we absolutely will take them all away and make sure we get them answered and put them in our post-event item that you can have access to. To our sector partners in the audience today, we'll see you tomorrow. And to everyone out there, please don't hesitate to contact us. Have a wonderful afternoon, and we look forward to seeing you at our next Tech Talk next month. Goodbye for now.